Today we're looking at the classification Azole Antifungals. And if you've been with me for any length of time watching my pharmacology videos, you know I love a good word. And these 5 letters here, surprisingly, pack quite a punch. Now I can't wait to share with you everything that I've put together to help you understand how these drugs are used for the body, when we would use them, and what we need to teach our patients about them. But I also can't wait to share with you the ways in which I use these 5 letters to pull forward a lot of that so you can spend your time focused on the patient and not memorizing silly, wild, out there, crazy things. But we just get right to the heart of the medication. I just want to let you know as you walk through this video, you're going to see that the camera focuses and then becomes unfocused. I was unaware of this when I made the video, but I didn't want to redo it all. So just stick with me through it. There's going to be a lot of amazing content here, and I'll do better in the next one. My name is Tammy, this is NurseMinder, and today we're focusing on the classification Azole Antifungals. Now be sure to watch right to the end because there's always an NCLEX question to help you put all of this information, synthesize it, and test yourself at the end. Now, Azole Antifungals is one of the largest classifications or largest groupings of antifungals. They treat everything from head to toe, inside out. So our first clue is AZ, A to Z. So we are actually treating, I'll use this one here. A to Z, everything from head to toe, inside out. It's a large spectrum. It is the largest. So if you ever get a test question and it says which one of these is the largest group of antifungals, you know it's the azoles. Azole, that's going to come in handy later. The second clue right off the hop is that Azole is actually found inside the drug name. We have Fluconazole, ketoconazole. In fact, you'll notice conazole is the extended form of what you're going to see in most of these drug names. Conazole, ketoconazole, itraconazole. So there is a way to recognize them really quickly. Couple exceptions. They're down here, isovuconazonium, but it's embedded in the word. So it's not the ending, but it's embedded in. And then we just have one that you have to memorize. Instead of having to memorize all of these names, you just have to recognize terbinafine or terbinafine as an antifungal under the azole family. Here's a trick. Here's a way to help you memorize it. It is a fine antifungal, AF, to treat, and it's going to be toe, fingernail, and toe fungus, and tinea capitis, which we'll talk about in a little bit, but this T is a clue. All right, so when you don't have to memorize all of the drugs because you recognize the ending azole, and then you just have to memorize one, terbinafine, a fine antifungal, AF, antifungal. Now, as always, we need to know, how do these drugs work? Well, there's another clue inside our word, OLE. That is the ending of the word sterile, ergosterol, sorry. They work by binding to the sterols or to the ergosterol to cause cell death. Using our A to Z theme again, everything, it's wide range. We also know there's going to be a wide range of delivery methods. It can be an oral medication, an IV medication, a topical, and even a shampoo. There are some clues in many of the words to help you know which ones are which. So in general, all of these are oral medications. Some of these can also be delivered in intravenous, which means you can start a patient on an intravenous antifungal and transition them to the oral medication when they go home. Here's some of the clues. Our IV medications, so we know that they're all available in oral form, but our IV medications, the clue is some of the words have the letters I and V in them already. So voriconazole, it has IV in it. Isovuconazonium has IV in it. There's 2 more on here that are also given IV. Fluconazole, and if you think of when you come into the hospital with the flu, you're likely getting an IV to get fluids for hydration. And then this one is a memorization one. Fluconazole. I'm thinking poser, so they're not necessarily showing who they truly are, so there's no IV in here to tell me. This is the only one you'd have to remember as being also intravenous, along with voriconazole and isobuconazonium. So they have IV in it, flu you're getting an IV, and then we got the posas. Now just remember, keto is special for a lot of reasons. One of them is it also comes as a shampoo and a topical formation to treat fungal infections. There's a special thing here about terbinafine in that it can be sprinkled as capsules for children. So there is one more anomaly here in that it can be a sprinkled capsule. Now, speaking of patients, we know we have little ones to old ones, and you'll see that I've got a smiley face here beside fluconazole, ketoconazole, and terbinafine. These are the 3 azole antifungals that have pediatric dosing. Now, here's a fun way to help you remember the side effects. Now, they are pretty common side effects, not likely to require a memorization aid. But if you think of ole, like a Mexican party, we have piñatas. Now, as piñatas, as you're hitting them, you got your head up all the time, so you start to get a headache. You eat that candy, you have abdominal pain, maybe nausea, vomiting, diarrhea. A lot of GI side effects with fluconazole or with antifungals in the azole family. So just thinking, ole, azole, and we can think of those really common side effects that are most likely to be experienced by our patients. Piñata, headache, candy, sore tummy, don't feel so well. And the one last thing to add would be a rash. The skin can develop a rash. All right, we're gonna come back now to look at ketoconazole in specifics because I have a little story that goes along with the piñata, ole, 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 ole. That's gonna help you recall some of the treatment or some of the diagnoses that it treats. And then we're gonna leapfrog off of that one to show you how another drug comes into play. So here's the story. We're trying to get at this piñata, but now we're looking at this piñata and we're trying to think, what diseases am I treating with an azole antifungal? Here's the story. I am getting exasperated trying to open this piñata. So aspergillosis. In this exasperation, I might break down and cry for a little while. Cryptococcosis. And then I'm going to pull my socks back up, and you know what? I'm getting a little cocky. I'm going to get in there and I'm going to blast this piñata. Someone's going to have to tell me how to say this one. Coccidioidomycosis. Blastomycosis. So I'm exasperated, I cry, I get a little cocky, I'm going to blast this piñata. History tells me, histoplasmosis, there's got to be candy in there. Candidiasis. And at the end of it all, I'm just so perplexed, I don't know how to break that piñata. Scratch my head and find out I have dandruff. So that's just a real quick fun story to tie in with the piñata theme. So when you look at azole, we're going to now look at it as azole, and think of the OLE as the piñata party, Mexican, and we'll be able to recall some of these diagnoses and attach them to ketoconazole. Okay? It's a fun one, right? Like, this word packs a punch, like I said. Now, first of all, most of these are respiratory illnesses. They come from inhaling the spores found in mold. That can be in your home, or it can be out in the woods, like in those wet, soft spaces of decaying woodlands. It's also in bird droppings. Bird droppings is critical key here because cryptococcosis, when it migrates from the lungs to the brain, and I choose the word migrate on purpose, it's going to help you remember. You're going to then need to treat it with fluconazole. It flew like a bird to the brain, and it becomes cryptococcal meningitis. All right, so that's the ketoconazole. It's a key antifungal in the azole family. We now know fluconazole is also going to be added in, or the drug of choice, if we have cryptococcal meningitis, because the cryptococcosis has moved from the lungs to the brain. Fluconazole is also used for candidiasis, that yeast thrust infection in the mouth and in the vagina. vagina. Okay. Now, just a few I'm going to touch on here. Fluconazole is a prophylactic. So remember, P for prophylactic in patients who are immunocompromised. And terbinafine, remember this is the outlier, the one that we have to memorize as being an azole antifungal. A fine antifungal for toenail fungus, so onychomycosis. This is your fingers or your toes. And tinea capitis, which is ringworm of the scalp. Okay, those are your abnormalities to just put a little attention to, and then the rest of it will just fall into place. Now there's one more thing that is super critical to know about azole antifungals. There's some critical contraindications, and understanding why they're contraindications requires us to look at the enzymes. So for example, they can cause liver toxicity. If they've got bleeding issues, we want to know about that. So why is that? Cardiac issues would be something to look at when they're on an antifungal. Why? This has to do with the enzyme family CYP450. And trust me, I'm going to fit this into the word. Now, I am going to link a video in the description box below. Dirty Medicine has done a fabulous YouTube video explaining some of these things. So CYP450, first of all, is a family of enzymes that are utilized to metabolize or break down the medications that you take. They also have a few other functions in the body. While we're going to focus on metabolism, they also are responsible for the synthesis and breakdown of hormones like estrogen and testosterone, and for vitamin D metabolism. So how do we remember that? Here we go, girls and boys. Azole has 450 in it. How cool is that? Okay, so our CYP450 is an enzyme that is often found in the liver. It's also in other parts of the body. And when it detects that there's a medication in the body, it will bind to it so that it can begin to break it down. So it can be transformed into smaller components that are water soluble, so it can be excreted through the body through urine and feces. The CYP450 can be activated to work faster or slower. The azole antifungals decrease, so they inhibit this process right here. And so it takes longer for the drug to be metabolized. So what does this mean for our medications? When we take an azole antifungal, if it is inhibiting the work of the CYP450 enzyme, there are other medications that take the same pathway for metabolism. So for example, warfarin, some of our cardiac drugs. And so if they're taken in conjunction with these other medications, we are slowing down the metabolism of those other medications as well. Hence why when we look at telling our patients about the fact that if they have increased bleeding, they notice more bleeding time, or they're noticing some cardiac issues, we want to know that because it may actually be impacting the other medications that they're taking, and we'll have to change the time of the medication, the dose of the medication, either the antifungal or the other medication it's impacting. And we sometimes need to just change medication. Cap of everything this 5-letter word shows us. We know that the words will end in azole, fluconazole, ketoconazole, itraconazole. So they're really easy to identify as an antifungal. We know A to Z, head to toe. It's the largest spectrum of antifungals out there. We know that's going to end in azole. We're going to take the Ole to help us remember side effects, headaches, abdominal pain, nausea, vomiting, diarrhea, and rash. We're going to take the Ole to remember some of the respiratory illnesses that ketoconazole treats: aspergillosis, cryptococcosis, coccidioidomycosis, blastomycosis, candidiasis, histomyosis. Right, so we got that whole story that's in your head now that you can remember and recall all of those diseases. Those come from molds in our house, in the outside, in bird poop. And then if cryptococcosis migrates to the brain, we're going to use fluconazole to treat cryptococcal meningitis. So we got a lot from this Azole word already. And then we're adding CYP450 as the enzyme that it inhibits. So we know that Azole Antifungals will inhibit the enzyme CYP450, which is responsible to break down our medications so we can get rid of them and they don't build up to toxic levels, which is why we're giving an Azole antifungal when somebody is on a medication for cardiac or for diabetes or for anything. We need to check to see if there's a drug-to-drug interaction, because if there is an interaction, we know that it inhibits the ability of the body to break down and get rid of the other drugs, and then that means we have a buildup, a potential toxicity. It binds to the sterols or the ergostrols to cause cell death. So there's that other clue in the ole, the ols. Now let's go to an NCLEX question. You are admitting a 14-month-old child to the pediatric intensive care unit for a diagnosis of cryptococcal meningitis. Which of the following drugs do you anticipate the physician will order? Select one. Ketoconazole, terbinafine, posaconazole, or fluconazole. So pause this video, and when you're ready, come on back and I'll share the answer. If you selected fluconazole, congratulations! You recognize that ketoconazole would have been great if it was cryptococcosis, but because it migrated to the brain and we have meningitis, we need fluconazole. Great job! Thanks for watching. If you like this video, hit subscribe and follow for more videos that will help you take a word and see so much more to help you get through those tests faster, but also to care for your patients better. Subscribe and share this with your friends, and of course let me know in the comments below how this is helping you. I read every comment and I do respond. And here's a challenge. In the comments below, think of the word Azole and write down everything that you can remember now as it relates to giving this medication. It should be a lot, and if it's not, go back and watch it again and see what you can pick up on. And just a reminder for those of you who are looking for content to help you with the relational part of nursing, I have a separate channel called Communication for the Workplace with Tommie, and I talk about all of the challenges in conflict workplace building that may be getting in the way of you feeling safe and doing your job. So be sure to head on over there. You'll find a link in the description box below. And until next time, make it a great day.